Barrett's esophagus is a change to the lining of the distal esophagus, which is the food pipe which carries food from the mouth into the stomach as a result of long-standing reflux, which may be because of bile or acid. GORD or GERD or gastroesophageal reflux disease is a broad term which includes heartburn and or regurgitation. Heartburn is caused either by acid or bile. When this is present on a long-term basis, it causes chemical damage to the lining of the esophagus, resulting in Barrett's esophagus. About 10% of people with chronic symptoms of GERD develop Barrett's esophagus. Most patients with Barrett's esophagus do not have symptoms. They are detected when patients with indigestion or heartburn undergo a camera examination. It may also be associated with symptoms of regurgitation and difficulty in swallowing with food coming back up. Heartburn that occurs at least twice a week is significant. This is characterized by a burning sensation in the chest and vomit in the back of the throat. Other symptoms to watch out for include heartburn that wakes you up from sleep, painful or difficulty in swallowing, sensation of food getting stuck in the back of the throat, constant sore throat, sour taste in the mouth, or bad breath. Barrett's esophagus increases the risk of developing esophageal cancer, though the risk is small. It is important to stress that many people with Barrett's esophagus do not develop cancer. Between 3 and 13 people out of 100 with Barrett's esophagus will develop esophageal cancer in their lifetime. Each year, less than 1 in 100 people with Barrett's esophagus develop esophageal cancer. Barrett's esophagus is not reversible, but it is possible to prevent progression. The primary goal of treatment is to prevent or slow the development of Barrett's esophagus by treating or controlling acid reflux. This is by lifestyle changes, including dietary changes, that is by reducing fatty foods, caffeine, spicy foods, chocolate, avoid alcohol, and stop smoking. Losing weight also helps. Having a gap of at least 3 hours between the last meal and the time you go to bed will help with the symptoms. Medical management includes antacids, Rennies, or tablets called proton pump inhibitors, which will reduce the severity of symptoms. Even after all this, if the symptoms persist, then we may have to consider surgery, especially if you have got hiatus hernia. Surgery is recommended after undergoing 3 investigations in the form of a camera examination, a X-ray test called a barium swallow, and a 24-hour pH and manometry studies.